Ambulatory care is a different way of delivering chemotherapy. For many patients with blood cancers, treatment can be given outside of the hospital with the full support of the haematology nurses and doctors. This includes chemotherapy, supportive care, or even bone marrow transplantation. With ambulatory care, the patients come to the hospital so they can actually deliver the treatment, but then you're able to go home or to nearby accommodation so that you're not spending so much time on the ward. There are many benefits to this approach. One of the big benefits to having treatment at home or in a home-like environment is that you can feel more relaxed when you are having your treatment. You can eat what you want when you want. It's much more peaceful than being on a ward. It's much less noisy, you can sleep in your own bed, and you're not being disturbed. You are around your family and pets, and you're part of family life. You're able to do more for yourself, like making a cup of tea or a bite to eat whenever you feel like it. You can continue to maintain your independence. Often patients go through ambulatory care for a part of their treatment. For example, someone having a stem cell transplant may go through ambulatory care for the first 5 to 7 days before being admitted to hospital. This shortens their stay in hospital by about a week, which is one less week in the hospital.
However, ambulatory care is not for everyone. Some people may have reasons they can't have the treatment via ambulatory care. For example, poor mobility or a complicated medical issue. It is crucial to be able to return to the hospital in the event of a temperature or other symptoms. That's why we need patients to be able to return to the hospital within the hour of reporting any problems. Some people don't have the transport to be able to return that quickly or live more than an hour away. In these cases, patients can stay in the accommodation right on the hospital site and still have the benefits of ambulatory chemotherapy.
At each visit, you'll be assessed by a nurse. They will take your observations, including your blood pressure, pulse and temperature. If required, you'll have blood tests taken and any other tests needed. If there are any concerns by yourself or your nurse, you'll be reviewed by the medical team. The length of time you spend on the unit will depend on what treatment you're having. Please be aware that some treatments might take longer than expected and you may experience some delays. Some days you also may feel more tired. Please do keep this in mind. At the end of each visit to ambulatory care, your nurse will assess if you're medically fit to return home to the hospital accommodation or if you need to be admitted to the hospital.
Some patients will have their treatment administered on the ambulatory unit. Others will be connected to a small pump which will deliver treatment at regular intervals. The benefit of this is that you can continue your normal daily life without too much interruption. When you're undergoing treatment in ambulatory care, the same principles apply as if you're having treatment in any other circumstances. You need to look after yourself and you must report any signs and symptoms should you become unwell. During your time in ambulatory care, you will be expected to be responsible for your own medications. Staff will go through the medication with you at each visit. You will not be expected to give yourself any chemotherapy. This is done completely automatically via the pump. Most of the time, the chemotherapy is well tolerated. That's why we don't need to deliver it as an inpatient. But nonetheless, it's really important to look after yourself. You will need to contact the hospital if you develop one of the following symptoms: fevers, a temperature over 37.5 degrees, shivers or hot flushes, persistent episodes of nausea, vomiting or diarrhea, shortness of breath or difficulty in breathing, redness around your Pick or Hickman line, any signs of bleeding, or anything else that you might be worried about.
If you feel unwell, you will need to contact the hospital via one of the contact numbers provided, and this will be available 24 hours a day. You are never alone or without support. The staff are trained to give you advice about the management of any complications, and you may be asked to return to the hospital at short notice. We always have a bed available on the haematology ward to admit you straight away in the event of any problems. You would not be expected to go through accident and emergency. It's therefore important to have an emergency bag ready at all times to walk out of the door should you develop any problems. This should contain the items you may need in hospital, like a wash kit, night clothes, phone charger, tablet or laptop. Please also remember to bring in all of your medication should you need to be admitted to hospital. Now let's hear from one of our patients, David.
I'm David Catlow. I was diagnosed with mantle cell lymphoma. I'm awaiting stem cell transplant, which starts tomorrow. So when I realised that the chemotherapy, one of the chemotherapies, alternate chemotherapies, was 3 days of treatment, and there was a choice. I was lucky to have a choice. I could either stay in the hospital for 3 days, or I could have the CAD pump, which allowed me to go home and sleep in my own bed. So as far as I'm concerned, that was a no-brainer. Why would I choose to stay in the hospital when I can go home and be in my own bed? So the CAD pump was fabulous, and to have that opportunity, to have that choice. So I chose to go home, and it worked well. I was at home having my chemotherapy, which feels a little bit bizarre, but it was great. So far, because of the CAD pump, I haven't had to stay in at all. I've come in as a day patient on every occasion into the ambulatory care team here, they're just a wonderful team. And they come in and they know your name, and there's a cup of tea in your hand before you've even sat down, which is fabulous. And then you come in and they change the CAD pump and off you go back home again. And that's been so helpful, so convenient. The fact that somebody's been able to, or very generously funded this so that patients like me and many, many others can benefit is just wonderful. It is very, very generous. I think we all recognise how much under pressure the NHS is. It can't have every option and all treatments available. So to have the generosity, the support of somebody who's funding these sort of activities, they really do make a difference to patients' lives. It just makes a very difficult time in life that little bit easier, and that's just fabulous. Thank you.